Medicine, and today we're going to be going over facts or myths about spine surgery. I'm Amanda Armagast.
And I'm Dr. Abbasi for Essence.
So I'm just going to be asking you fact or myth, and then I want you to go over briefly why it's a fact or a myth, and then you can go into more details.
Okay, let's start.
Okay. So fact or myth, spine surgery always causes paralysis.
Well, obviously, in medicine, every time you say the word always, it's a wrong statement. Doesn't really matter. You don't even really need to continue after you hear the word always, because medicine is good or bad. As a matter of fact, if the question would be spine surgery always cures your problem, that as well is wrong. So, as a matter of fact, regarding the paralysis, it's extraordinarily rare that the spine surgery itself caused the paralysis. Um, First of all, in United States in 2025, it's rare that anybody from spinal condition is rare. It happens. Anybody from a spinal condition become paralyzed. As a matter of fact, many cases that patient naturally would become paralyzed, spine surgery saved the patient. But if I would just categorize in those very rare conditions that people are paralyzed after the surgery, 9 out of 10 times is that surgery couldn't cure the initial condition. That's why people go paralyzed rather than the spine surgery caused the paralysis. We have a lots of technology these days that help the patient before the surgery. We get imaging. We know exactly what we are going to deal. A spine surgeon like me goes through somewhere between 15 and 20 years of education. We are really good at it. And then we have neuromonitoring. We put electrode that we see the condition of the nerves while we are doing surgery, and a lots of technology. So, question number one is absolutely wrong.
This is another question that actually I think we've talked about before, but I bring it up a lot because it's something that I've heard in my own family personally. You should reconsider spine surgery based on your age because you will lose mobility.
That is as well a very good question about do we lose mobility when we get spine surgery? And that is a myth, by the way. Um, by, by the time we need spine surgery, that mobility is already lost. So this is how, like, it's lots of people ask me about the neck. This question that, oh, you're going to do this surgery and that surgery. Am I going to lose mobility? And my question is, then what can you do now? At least you can do the same or 9 out of 10 times more actually. What is the reason? There are two kinds of spine surgery. One kind of surgery, we just open up the space. So there's no reason for you to lose mobility. Then there is a kind of surgery that we literally make two bone grow together, get rid of the bad disc. We call that fusion. In a fusion, that segment is going to be immobile. And in the neck, it's about 50% of the motion is between the skull and the second vertebrae, and then every other motion disc has 10% motion. Now, let's say I fuse two of your cervical disc. So if I would literally take two completely normal disc out, you would lose 20% motion. Now, number one, why would I ever fuse a completely normal disc in your neck? There's no reason. So we don't do that. So by the time you get to a spine surgeon, those discs are degenerated. There is no motion. As a matter of fact, every time you move, part of that, like a rubber of a tire that's falling apart, part of that remaining thing push on the nerve cause you pain. As a matter of fact, once I take the pain away, you can use the rest of the 80% that is already, possibly still there. And number two, if I take 20% of your motion in your neck away, you won't notice any difference. As a matter of fact, I have a video out there showing the Olympic gymnast and then pointing to that only an Olympic gymnast will notice 10 or 20% reduction in the motion in their spine because they put their spine to complete use, and only those are the people who would notice that. So, an absolute myth that no, sometimes spine surgery doesn't work. What that means is that you have complication, you have other things that limit your spine. So what that means is that we don't solve your problem, and we never can 100% solve all problems. Then obviously you continue having the limitation, and memory is something faulty. Like I have a lot of patients that I document what they can do, what they cannot do. When I see them sometimes, we're still having some problems. They don't remember the problems they have. They only remember the problems they have now. But then when we go look back, that's why we document things. That's yes, they had the same problem. As a matter of fact, surgery did help them, but not to the extent that they expected. Like, um, this is a really interesting and true patient. Patient is 89 years old. I see the patient 1 year after the surgery, and patient is extremely angry with me. And and then we go to the bottom of it. We saw that patient could barely walk an eighth of a block. Now he can walk like 2 blocks. The pain was 8, 9, 10. Now the pain is generally 2 and 3. And in every exam, everything has improved. But patient is angry because he cannot go on a motorcycle ride with the 84-year-old wife from North Dakota to Sturgis in South Dakota, and so on. But he completely forgot how miserable he was before the surgery and what the situation is now. So that is an absolute myth
What was the myth?
that you lose
You lose
mobility after a spine surgery. Even if you do fusion, even if you do, no, you will lose mobility in spine after you pass the 14-year-old. After you're 14-year-old, mobility in spine will go down. And the diseases make it go down much faster. And we made that video, A Natural History of Spine. Everybody should look it up, A Natural History of Spine. But then the disease make it go faster down. Spine surgery sometimes is not successful, but 9 out of 10 times it restores some of that mobility back, but not to the time you were 20 years old. And that is the myth part, that they think that spine surgery and not the natural history of spine make them mobility go away.
Right. So then, fact or myth? Some patients can walk the same day after spine surgery.
Very true, especially with the minimal invasive spine surgery. That's the goal of the surgery, to make you walk same day. I did multi-level surgeries. I mean, 4 levels with one of the biggest surgeries. Not only patient walked same day, they went home under 23 hours. That is truly the advancement of the technology and the minimal invasive surgery that enable people walk same day. And that is not just walking, it's extraordinarily important. All the complication are less if you walk. Our body is made to walk. Some of these surgeries, I remember what I would do, it take patient 3-4 days to walk. In that 3-4 days, that's practically like a minefield for problems to happen, like DVT, pneumonia, and the GI tract,
Just being out of
ileus.
the hospital is
Is
good.
is extremely important. But now, having said that, in the old age, literally, we would take a piece of your hip, put it in the stead of where the disc was, and we didn't have anything to stabilize your spine. And it would take sometimes 6 months for the people before they can independently ambulate. By the time they could walk, they had no muscle to walk with, because that immobility would that take that way. To a big extent, this still applies to the regular traditional open fashion surgery, but in the minimal invasively is not a myth.
So do you think that is it true that people are mostly having more open surgery if they have a complex case? But most spine surgeries now, do you think, are minimally invasive?
No,
Or
actually, that is the travesty of it. Still statistically, for every minimal invasive surgery, there are 3 open traditional surgeries performed. So when you look at us, we do most of our surgery minimal invasively, but we are, on the far front of it. That's why we are able to do that. and other people can't.
What's the reason that there's so many open versus minimally invasive?
That's how people, surgeons are trained. They're trained to do it that way. They're good at it, and they don't have time to go back to school and learn it the other way.
Yeah, that's what they're comfortable with.
Yeah.
Fact or myth? If you get one spine surgery, you will need more spine surgery later in life.
Um, this is a multifaceted question, very complex question. As a matter of fact, this is the holy grail of spine surgery. Every conference you go, we talk about the so-called, what we call them, adjacent segment disease, meaning you got a surgery in one segment, and then the next segment, up or down, go bad, and so on. Now, I I tell all my patients, your spine, your discs are like a tire of your car. Like a tire of a car, there's three reasons for the tire to go bad. Number one, is it a good tire from a good company, a brand, or is it a no-name cheap? And that's your genetic. You truly come with good genetic or bad genetic. Now, you cannot change anything about that. Let's say you get the best genetic, you get a Michelin tire, the most expensive tire. But if you drive it 150, 200,000 miles, you still will have wear and tear. You will still have problem. That's the aging process. And again, nobody really can change that. The third factor there is how you use your tires. You go on a construction zone where there are lots of nails and sharp stones around, or you do drive it regularly on regular roads. How you use, like we know that um, high level athletes, their joints, their spine is 10, 20, 30 years sometimes older than they are because they put them to a tremendous amount of use. And that's a different conversation. So the third factor you do have influence on. Okay, if you overuse it, you're going to wear and tear for you fast. And now, let's say take that car. You have a flat tire for whatever reason. You come to my shop and I fix that car for you, and then you go there 2 months later in spine, maybe years, 2 3 years later, you have more spine problem. Now, did you have the other flat tire because I fixed your first tire, or was it the natural progression of the disease that caused you have that problem?
Most likely the natural progression.
Most likely that, but there is another factor that in a traditional open fashion surgery, we destroy a lot of things just to get where the problem is. And that destruction that we put in place makes reduces the spine capacity. It is like taking few years of your spine life. So the truth for open traditional surgery is probably somewhere between the natural progression and the spine surgery in a traditional way cause so much damage that it contributes to that. We don't know how much, what percentages. But that's the idea that open traditional surgery caused that damage and minimal invasively doesn't. So as a matter of fact, we are running that study right now, and everybody I have talked to anecdotally, and I definitely am in that camp, that we think minimal invasive surgery reduces the chance that you have additional problem down the road. But we have to, in a academic way, we have to write the paper, we have to run the statistic to prove that. So this is a very nuanced, but I would say probably is 70 for open traditional surgery is 70-30. 70% is a natural progression of the disease and 30% is the surgery. That's my best educated guess after being in this for 30 years. For the minimal invasive surgery, I think I would dare to say, in my gut feeling says that it is 98% the progression of the disease itself.
Am I correct when I say that sometimes also the patient might have like 2 areas or 3 areas that have a problem and you fix the one that's worse first, let them recover, and then maybe go and fix the rest?
Yeah, and that is exactly, it goes in the direction of natural progression of the disease. We barely see somebody that has one problem one place and then everything else is perfect. And we consciously decide not to do a humongous big surgery. Some surgeons do, but we don't. So meaning that we just educate the patient, listen, we fix this because this is in more dire need of help, but we are not going to turn you back when you were 25 years old
Mhm.
and make you younger. The surgery doesn't make you younger. As a matter of fact, if you watch again that natural history of spine, you see that patients expect to be there when they were 20 years ago, sometimes. And that is the expectation we surgeons need to educate the patient about.
Yeah.
Because if they think they are going to be 20 years younger, we call that the so called Benjamin Button curve, or the curve of eternal dissatisfaction. So,
Makes
because that is
sense.
that's not natural thing to now some of the patients do come to us and say, I feel 10 years younger, but these are people who we can restore them to the back to the normal natural aging of the spine after they fall off the cliff with a spine problem.
So the next question is specifically about lasers. So I'll just stay on the lasers.
Yeah, you see the big smile on my face.
Not robots, lasers. No, let me
Lasers.
ask the question. Lasers are the main tool in spine surgery today. Fact?
Absolutely false. Absolutely false. Um,
I've never, maybe I'm not paying attention, but I've never seen a laser in your OR.
no, you have never seen it. And well, let me tell you, I started my residency in Germany, in University of Heidelberg in Mannheim, in 1996. At that time, we had a laser machine for the spine that was collecting dust for 8 years already in the closet. Laser is one of those things that not only we have no evidence that it works, we have actual evidence it doesn't work. Well, let me tell you what laser does. Laser produce very focused heat. So what it does, it vaporizes the tissue. Now imagine a piece of something is pushing on the nerve. Well, I can go and with the laser, layer by layer, just vaporize it and suck it out. Or I can go with the grabber, take a piece of it and pull it out. It adds to the time of the surgery. It doesn't work. There was a company called Laser Spine Institute. They went out of business rightfully a few years back because they would just use that catchphrase to get the patient. And some patient, because insurance wouldn't pay for that, they would sell their houses to get the surgery. Obviously, those patients were very angry. And
Yeah.
if they wouldn't get the result, which they didn't, they would sue the company. So they went out of business a while back. So in every conference you go, in every place you are, laser in the spine surgery is nothing more than a gimmick. And you will see a lots of smirks on the face of spine surgeon actively performing spine surgeon when you hear laser in the spine.
Okay. The next one is another smirky one.
Mhm.
Robots can now perform spine surgeries by themselves.
That is number one, absolutely wrong. And I need to give you a little background to that because without the background, everything is relativized and put out of context. You know that, but some of the people who hear us may not know that. In 1993 to 1998, I wrote a dissertation in Germany about the use of computers, mostly image navigation, and less robot about how to use those technologies in the OR. So I'm extremely familiar. For any robot to work, we know robots are accurate. We are using it all the time. But robots are extremely accurate if everything is the same. Like you have a car that everything looks the same. This nut is always the same place. This welding point is always the same. Robots are perfect. We are using it since 1970s. Humans are not like that. And if you're 2 millimeters to the right or left, it's a matter of living or dying.
Mhm.
So the surgical navigation has been very helpful in the brain. And in 2000, I actually helped to develop these kind of technologies in Stanford for the spine even. But it is a tool. And every time we human try to replace our skills in the surgery with a tool, that instead of learning it to do it and use a better tool, we ask the tool to do the job for us. It always backfires. I just reviewed some literature regarding that. Uh, More than hundreds of people have died of not only the robots not doing the surgery, hundreds of people have died in worldwide, and I think 14 United States from surgeon trusting the robot more than they would trust their own skills. 40 people have died in the United States, and it all comes back to that um, we always adjust our plan or what we are doing as we go. We gain more information. Robots don't do that. They are
They're
so.
programmed to do a specific job.
Yes, and in these cases, robot wasn't doing the job. Robot was just giving, like, based on navigation, the systems that I'm very familiar with, telling them this bone is here, this artery is there, and they bump something that tell the robot where it is, just few degree, and then all of a sudden, the robot was working with what we call historical data, where those structure were 5 minutes ago, not they were now. And then it wouldn't correct for that, whereas surgeon correct for that and does a better job. I think uh, a fool with a tool is still a fool. So meaning if you don't have these skills, if you're a bad surgeon, even with robot, you still are a bad surgeon
Almost, and I feel like a bad surgeon with a robot is almost more dangerous.
because they trust themselves to do more than they're really able to.
And then when things go wrong, they don't have the skills to jump in and fix it.
They
Which
don't
is
have a plan B.
why I hear you telling people they still need to learn open if they're doing MIS, because if something goes wrong, you need to know how to fix it.
Yeah, some people now. What is the dangerous thing is, and I just was in a meeting just this Sunday about this faculty from one of the highest place United States that they don't teach their resident even do open traditional surgery anymore. They just teach them the robot and so on. And that is the industry pushing it. That's not natural.
No, and that's a whole other topic, but that, in my opinion, is just taking away human skills that are not replaceable with robots.
I know you know what the joke I'm going to say.
Tell me a joke.
So the joke is that when my patient asks me if I'm using robot and navigation, say, yeah, I use the most advanced computer in the whole planet, which is between my ears, and I'm using the most advanced robot, which is attached to my shoulder, my hands. You just have to train them. You just have to work on those skills, and those skills are acquirable. You can acquire them, but you cannot be lazy. You have to pay the dues. You have to go and train yourself. Now, if you want to, instead of going training and getting better at that, you just want to rely on machines. But that is what the dangerous part, that industry and some of these robotic companies, some engineers that have 2 years of engineering, some person make a program, an algorithm. And as somebody who does it myself, I look at that, I say, there are 2,000 places this can go wrong. This is not generally applicable.
Yeah.
So, and then all of a sudden you see people that they put the screw in the wrong place, and then and then that gets better now. Then they come and compare the best performer on the robot to worst manually skilled surgeon and say robot is better. But if you go to the community, you look at everybody, and then you see, I dare to say, if you do it really head to head, and you put the good surgeon and compare it to good surgeon, surgeons are, I would say, at least 7, if not 10 times more accurate than any robot. That's beside the fact all the time that you add to the surgery. By the
Yeah.
time a good surgeon is already done by the time they bring the robot and all the machine in, and every single technology you add to the OR is a piece of technology that can fail you.
Exactly.
Okay, that is, so it's a dangerous things that I see happening
And I'm
now
sure it adds to the cost of the procedure in some way.
tremendously. Like, these robots are millions of dollars. Just the maintenance is hundreds of $1,000s a year. Whereas we just give this Indian surgeon, African surgeon, a handful of instrument,
Mhm.
few $1,000s, and we teach them, and they do a better job than the robot.
And they teach other surgeons too.
And yes, and they teach other surgeons. That's
And
exactly the
that
correct.
rolls into my next question, which I have a complaint about afterwards. Um, Spine surgery has the same success rate as it did in the 1980s.
No, that's absolutely incorrect. If you have much better results to date than in 1980s, we have learned a lot in the even in the last 10 years. Like I can the example I'm going to give you. In 2003, when I did my first spinal fusion, it was a 7-hour surgery. We lost more than a half a gallon, half of the blood of the patient. The surgery for one level surgery was 7 hours, and patient stayed 3 days in the ICU, stayed good part of 3 weeks in the hospital, and it took the patient 3 months before that patient could walk. Now I did a just last week. I did a 4-level fusion on an elderly who walked in 2 hours, went home next day, even under 24 hours, and I got a testimonial. She would look like somebody who had a dental procedure. I admit, obviously, we provide a different level of care, but even well, I don't. No, there's. Let's go back. There are still places in the United States that one level surgery takes 7 hours.
Yeah.
It shouldn't be. It should not be. We have much better
But
things.
haven't you told me in the past that spine is like the slowest moving, right? Have you
Field.
rephrase that?
Spine is now contrary. Now I'm a neurosurgeon. I work on the brain and the spine. So and every spine, every neurosurgeon want to be known first as a brain versus brain surgeon. We don't go advertise ourselves. So okay. I have to a little shit talk against the orthopedic surgeon. Okay.
Plug your ears.
Okay. Plug. If you're orthosurgeon, plug your ears.
Use your strong muscles to plug
Yes,
your
yes.
ears.
For orthopedic surgeon, the best they can be is the being spine surgeon, under reputation and so on. For neurosurgeon, we all want to be known as a brain,
It's fancy.
fancy and so on. And spine is the whatever. Yeah, we do spine, but no, and I have done both, right? I can tell you, spine is in complexity 10 times more complex. Like after you have done 7 or 10 brain surgery, it's a jelly. You open up the skull in a tradition, in a standard way. You open up the dura, take the, obviously bone flap out first, and then you have the brain. Or this anatomy. You use a sucker and a bipolar in this setting, and so on. After 7 to 10 cases, you're in. As a matter of fact, the board of the neurosurgery in Germany, when I was in Germany, required only 40 craniotomy to make you a neurosurgeon. I can tell you, after almost 4,500 spine surgery, I'm still learning. So the question was,
Are we still where we were in the 1980s?
absolutely not. We are so much better, but that takes a lots of effort for us to be better.
And this is my complaint with the robots. I feel like that's a good way for us to form a bell curve in a way. We're going up, but then I feel like our reliance on robots and machines will make our cognitive like surgery and physical skills worse. So then the spine surgery results might go down.
I hope we don't come to that. It's my job to
Yeah.
make that not happening.
Mm-hmm.
It's and I'm
Can
working
you
on
see
it.
that happening?
Oh, I in every conference I go there, I talk about that. Then these young people come who have never done surgery without the robot, and they cannot do that. And I tell them, it is like any other skill. You use it as a tool, as somebody who has used that, and then these young people come, they say, oh, he hasn't used that, he doesn't know it, and so on. No, you're so wrong at so many levels. I'm against it because I know everything. I know
Yeah.
I wrote those algorithms that you are relying on. Somebody 3 years out of school wrote those algorithms. I wrote those algorithms, and so on. And there's so many places they can go wrong. If you don't have usual skills, you cannot even say or understand why they are wrong. So you use it as a tool, and you use it as a wrong tool. But if that's all you got, your desk, all of a sudden you have to use a Phillips screwdriver for a flathead, and then you're wondering why it's not working, and you're trying to force it, and that's when people will die.
Mm-hmm. Yeah. Okay, fact or myth? Older adults, and I mean like old. Like,
What is that is a good question. First of all, what's
I
old
mean
for
when
you?
that's so funny you say that because sorry, off note, but I was texting my grandma over the weekend about this guy I saw, and she's like, was this guy I saw walking, and she's like, was he old? And I said, yeah, he was in his like late 60s or early 70s. And she goes, my lord, Amanda, that is not
Now,
old.
it's interesting you say that. When I was in the med school, elderlies were defined at 65. When I was in residency, it was defined at 70. And now, generally, we consider elderly at 75 years
Okay,
old.
so let's say
So,
75 is my age I'm referring to.
mhm.
Elderly people should not are not candidates for spine surgery.
And there is this old way of surgery. We know that these surgeries can be 12 hours. They can lose half of their blood. Elderly people, they cannot really tolerate that much stress to their body. So there is a historical truth into that, that elderlies are less suitable for these long, bloody, invasive surgeries. Number one, at least in most of our societies now, we don't use chronological age, we use the physiological age. What that means is that you see some people who are in their 50s, but they have less capacity than somebody who's in their
My
80s.
grandma's neighbor just turned 80 and takes 2 walks a day, multiple miles.
Yeah, that sort of keep your heart young. So we look at their heart, at their lung, at their what we call physiological capacity, and then make that decision based on that. But at some point, everybody will go down.
Mhm.
Now, and it's always a balance. How much stress are we going to put them through versus how much stress can they take? Now, certainly we want them all be younger. That's what something we do. We want to live them. We want them to live forever. We want to keep their heart and go on the walk, have a dog. We talked about all
Yeah.
of that. But on the other side is the equation is how much can we reduce the stress of the surgery? And that is where we come in. We are so good at reducing, making a 12-hour surgery, a 1.5 hour surgery, making a surgery that you would half a gallon of blood loss, you have like 1/4 of a cup of coffee blood loss. By reducing the stress of the surgery, we can change the equation in favor of patient that nobody doubts they need help. We are just able to provide it to them.
So if you're 80 years old and you're still pretty much up and walking, maybe you have a little bit of an assistance like a walker or a cane, you can still be a candidate for minimally invasive spine
Well,
surgery.
that is actually it's interesting you say that. For a long time, we used to have, oh, you need a fancy card capacity, radionuclide study, stress test, and so on. But it's much actually easier. We have to be physician, clinician. Can you go a flight of stairs without panting? Can you go for a block or two of walk without being really, able, being unable to breathe and so on? That is all the question 9 out of 10 times you need. Now, if you cannot, then we can bring fancy thing. But same way that we spine surgeon, we want to have a robot because
It's
we don't want
fancy.
to. Same way, lots of medical doctors instead of examining the patient, then you get those situations. Doctor comes in, doesn't even look at the patient, look at some numbers, and walk out before has even put hands on the patient.
Hmm.
We are clinician. We are not engineers. We are not statistician. We are, and that is part of it. What I'm talking about that um, you have to make individual decision for the patient, not a blanket
Group,
statement.
yeah.
Yeah,
So, truth or myth? Lifestyle factors like smoking can make your back surgery less successful.
absolutely true. As a matter of fact, we just had that we were in two TV
Yep.
interviews, and that was all about. That's what I was saying. The most important factor on your spine health is your life style.
Hmm.
If you go for a walk, if you do exercise, if you have a healthy lifestyle, and there are few things that always negatively impact your health, period, not only your spine health or any treatment period, and you know what they are.
Pessimism.
Well, your attitude is very important.
Hmm. Walking, you have to be
Well,
mobile.
your attitude,
Hmm.
your physiological status, your physiological age, smoking, diabetes, and chronic diseases like osteoporosis or other chronic
Is
disease.
is alcohol like if you're
Always,
yeah, that's what I
always.
was thinking. If you're in would you put like I want to put it gently, but would you put alcoholism in the same category as smoking when it comes to lifestyle factors impacting surgery?
Unfortunately, smoking is worse.
Worse than alcoholism?
Oh yeah,
Okay.
it is worse.
And then fact or myth?
For the spine healing, alcohol, smoking is
Yeah,
worse.
yeah,
For your
spine
overall
healing.
lifestyle, is probably it's a hard
Totally,
toss.
probably totally
Hard
depends on
toss.
the
Yeah.
human. Fact or myth? Spine surgery can be completed and with an incision less than an inch.
We do it all the time. I mean, you know the answer to that.
Yeah, I know the answer. The answer is fact. And then my second to last question is I do yoga. If I had a sacroiliac joint fusion, would I still be able to do yoga?
Absolutely, you could do yoga. Now we have to understand, and I give talk about that. Sacroiliac joint is the Cinderella of the
Mhm.
musculoskeletal. What's specific about Cinderella? She's beautiful, she's good, and she's neglected,
Yeah.
right? And that's our sacroiliac joint. It is a disease that it's. If I had to choose anything, my musculoskeletal, I would choose sacroiliac joint because it's much easier treatable, but it's neglected. We don't look at it. We just don't diagnose it, don't treat it, don't evaluate it. And then people go tens of years with horrible pain. Now, sacroiliac joint is where our spine and pelvis are connected. And the only time physiologically moves is open up the pelvis for the birthing process. So, what that means, according to the anatomy, there's a motion of the pelvis. We call that open book motion, meaning that the two part of pelvis open up about 4 degree our pelvis.
Mhm.
But they think the way it works is that imagine if you open it up 4 degree, it end up being a huge impact on the opening of the pelvis. Now I don't promise, I don't go billions of years or millions of years back, but I go just hundreds of years
Okay.
back. If you read any old British novel, somebody dies in childbirth or somebody's orphaned because the mother died in the childbirth. Why is that?
Well, they didn't have the technology back then.
No, England had less sunshine than Spain or other places. They didn't get enough vitamin D. Their pelvis were smaller,
Oh, and they were.
and the baby gets stuck, and woman would die.
Hmm.
That doesn't happen anymore for two reasons. We don't really have problem with vitamin D deficiency. It's part of any pregnancy, and as well when people grow up as a children, and as well we have better nutrition. Number one, and we have C-section. We have really access to good C-section, and still C-section is a big deal right now. That process, opening up the pelvis, is a very active process. What that means, during the third trimester of the pregnancy, there are enzymes that come and loosen the ligament in symphysis, the front of the pelvis, and sacroiliac joint to make it more mobile.
Wow.
Yes, that's such a harmony in our body. Now, for that reason, within the next 2 3 years after the pregnancy and so on, the rate of sacroiliac joint is 7 times higher. So, sacroiliac joint has one physiologic motion, and that is open up the pelvis to for the pregnant woman to give birth. So, if you don't have plan to give birth in yoga, you don't need sacroiliac joint.
Well, if I ever do give birth, it's going to be during yoga.
So that you are the only person who will have an impact of the sacroiliac
Okay, and
joint.
my last question, my last truth or myth: if you have spine surgery, you will be in bed for months.
I, when I was in the med school and residency, that could be true. Not anymore. And that is because we don't cause too much damage. One of the most important thing in a Okay, there are few dirty secret of the spine surgeon. So, please, if you're a spine surgeon, don't lynch me for giving it to the public. One of those dirty secret is that we cut the muscle in a traditional surgery to get where the problem is, but we do not reattach those muscles.
Mhm.
So imagine you get a elbow surgery. I cut the tendon and I just let it float. Oh, I have a dinner meeting. I'm not going to sew it
That's
back.
just what we do.
Okay, bye bye. You just go. What? No, no, just imagine. Let's play it out. You have elbow surgery. I cut the tendon, and then I leave, and I just close the wound, and underneath, the muscle is detached. What happens then?
I feel like wouldn't I not be able to move my fingers?
First of all, you cannot move that joint. Number two is that what does the muscle do? Muscle
withers
contracts.
away
Now, see, our muscle, they have a balance about how much they contract.
and
Like
stretch.
when you have, well, stretch is passive, contracting is active.
Mhm.
That's a part. And there are some cells in the muscle and there are some cells in the tendon that give a feedback to our spine, not even in the brain. How much is enough? Have you ever had a cramp?
Yeah.
So imagine that cramp 10 times worse and not going away because the that detached muscle that's contract, but there's no way it can release the thing. That is how these patients are, and for that reason, it takes them a long time. By the time they really start getting rid of it is when the muscle dies, because a muscle that cut and doesn't, and that's what we do. That's our dirty secret of a spine surgeon, that in a traditional surgery, if you don't reattach those muscles, all those muscles go and die in a traditional what we call posterior surgery from the back, PLIF, TLIF, and so on.
But with the minimally invasive, what we just talked about, 1 inch incision.
We do not cut those muscles. They are all pristine. They are all intact. That is the reason these patients walk same day, go home next day, because we don't cut those muscles.
Okay, so I know you kind of just answered this, but with minimally invasive spine surgery, how long do you think a patient will be laying in bed
Hopefully hours.
while they're sleeping?
But as soon as they are awake from the surgery and the anesthesia medication doesn't make them dizzy, we want them to walk.
Okay.
We want them to walk independently. I just did those surgeries, 3 of those surgeries this Friday. Everybody next day went home, even multi-level big surgeries on elderly. Yeah,
Thank you guys for watching. This was Fact and Myth Spine Surgery Edition. I'm Amanda Armagast.
and I'm Dr. Abbasi for Essence.
Have a good day. Can we do